State Health Officer Dr. Thomas Dobbs telling us that on average, 131 Mississippians are hospitalized with the virus every day.
That higher caseload putting healthcare professionals on edge. They are putting in long hours and even working on their days off to deal with the rising number of COVID-19 hospitalizations. Our Chancellor Wen shares how nurses are managing that extra stress.
Alarms are becoming a far too familiar sound for healthcare workers inside of hospitals.
Now we're just completely full and obviously very tired.
Nurses like Lacy Lancaster are relying on one another to help manage these stressful hours.
This has just taken so much out of all of us, and we just come home, try to relax, rest, clear your mind, which is sometimes not that easy to do. I take my patients home with me a lot. I think about them. I pray for their families and them.
Singing River Health System CEO Lee Bond says many times caring for a COVID-19 patient can be overwhelming.
When you're having to tell a person that's 50-something years old right before they're intubated, they're like, am I going to live? And you have to tell them, we're going to do everything we can for you, but the tears are for seeing that happen over and over for people for something that largely could be prevented.
Bond says hospitals throughout the region are dealing with an influx of COVID-19 patients, the majority of which are not vaccinated.
If nothing else, the vaccine will keep you from going to the hospital and dying. And if you could spend time with me seeing what our nurses are seeing, the suffering that people are having with this that's avoidable, you would probably change your mind.
Reporting in Pascagoula, Chancellor Wen, WLOX News Now.
Singing River CEO Lee Bond says hospitals from Louisiana to Alabama are struggling to staff nurses and doctors to care for the amount of COVID-19 patients.